Musiaisia kwa ibinda yengi na ulocha ndini wa kilungu cha moka tulika ndini wa uonanania wito Mūthenya wa umundi otoni utavitie withawe Mūthenya wa Cancer ndi yonde kana World Cancer Day na kikoni cha umundi twenda umana yo cancer ni chao ibikite ba tulikana kana Mūthenya wa iyo mwini wa kuma ukamba wito wa Biz Kaviro ulona atembeye kuma 13 kuma kaunti ya Kitui atembeana mau esela kaunti ya Masako ngina ilomi Mūthenya wa iyo niwe ubikie na kunengane balua wake obisini wa President William Ruto yendekethia cancer itangazwe ta muisio wandi kana national disaster na balua wake aisi no bikie na indi nitwetelete kuigwa kuma kwa president na indi Mūthenya wa umundi twenda umanakana yo nitubikite bau ba kutangaza cancer ta muisio wandi ya Kenya na indi kikoni cha umundi atwina MØENI witola nenda kitale ngomotho cha tutabi masitwa make na lukumilaba na eka hata nye nitawa Robert Mutuko na indi ethi wawine kulyo tukulie kuisila kwa ili tatoka ndai mwitano namba ito ya otomani mukuve kana kuisila mitandaoni ito ya meko mukanilie na indi dakitali wa mukite hata tulika ni masitwa nondwe ayingine tukamani tana kuti binda yambe kwithi wanaito karibu sana.
Asante sana na kwa masitwa da Dr. Geoffrey Mutuma. Of course I work nento kumakundu kwingi muno lakini muno tukuma in Zambezi Hospital na neka cancer research in Cambridge. That's what I do na nini case cancer research for quite a long time ko na nedo muno give focus on cancer prevention, cancer control na muno as a pathologist which I'm a consultant clinical pathologist. I normally do diagnosis kana nini mana and marana mana kana mena cancer. I'm a pathologist in Zambe. So as myself, I cancer really under the microscope. So I know as a pathologist, I all the cancers and I can diagnose all the cancers. The only thing which pathology we don't treat, we just tell the doctors which is this cancer and which type of this cancer, and we stop there.
Okay.
Yes. Well, cancer, I don't treat cancer. Alama ita cancer ni another doctors that are called oncologists, which are very different from pathologists. But pathologist is one who we make the diagnosis. We tell the people with the doctors which cancer is this and which type of cancer and how you need to start treating it. But we don't go for treatment.
Asante. Na ine musiaisia tunamondola wa ilite nundu eka ukunikiliwa cancer ni kana kama na ya muthemba wiba na indi daktari Mūthenya wa umundi ni Mūthenya wa cancer ndionde yo Mūthenya uwe na bata mao pengine kwa ndionde globally na makwito ya Kenya.
The World Cancer Day ni mwana wa umundi na ni mwana wambetane almost 30 years ago na waetiwe nundu wa ulilikana andu alama na cancer alama tu nundu wa cancer na to see and makorone cancer. So the World Cancer Day are very important. Na to me is the most important day for the cancer patients. First, alama na cancer today. Nundu cancer is a major problem which almost in everywhere now. Na to me zambiye more so in Western type of countries, that is Europe and America and Australia. They were very much about it 30 years ago. What is very important in Kenya, cancer was not a major problem 30 years ago in Kenya. It was not there. So when you joke one of the cancer that we had educated Kenya, muno they no kamba kwitu kana education maitu asaisa maitu alama ke kamba monde weza kwithia cancer ipokwa wingi na inoki emetoke tikwa zakana woke tena then wakamba kwitu na hicho kitumi kwa asaisa maitu kila musiaisa omunde ni wezi kana cancer yibo na pa imundu tezi cancer yibo ko muna wa omunde the World Cancer Day muno ni create awareness kana kuhamasisha adu yolo wa cancer with the mama na cancer ni chao. Like from my side as the Zambezi Hospital nika cancer work kana cancer awareness work for almost 12 years now every year. Na I normally do it in February. Nundu mwai wa keli niwo mwai ula wa ulikana wa cancer is Cancer Awareness Month. Of course this month mwai uyo I was planning to do it to 28th but I postponed to 14th of March. Nundu muno ni for your schools. And it took to me when ila went to create awareness about cancer we select people who can pass information easily. Nundu, one of the major ways, and which of course I thank the media houses, they have created awareness about ni matapitiando kana kuzila media house, they have done wonderful job about inform and about cancer. They have done good job. Even I think for Mutongo TV, they have done wonderful because people know about cancer through media. Now, media is one of the best way to be able to create about cancer. In fact, we normally say that utaasiakana kumana wa cancer no to vya madhayo. To know about cancer saves life, not to treat. To know, just mundu kumana peke nukita wa cancer, that's enough. Nundu, in most cases, we don't want, and as person, I don't want to go to details about cancer. I normally focus on schools, because once you focus on a child, what's very important on a CNS, work, see, they don't know what cancer is. Nenda siane sisi kana peke nukita wa cancer, that's enough.
Na ndakitali tu wa kila mundu ekitayewa cancer akatelema. Yo cancer. Kwa kithiomo kitona kueleka ikila mundu cancer ni chao
be thisi twa kikamba ita wa cancer kwa kikamba
itumeta wa cancer
ita wa cancer kwa kikamba no no kimetoke and it was not there. Cancer ni mwiwe na apate mubango wita wa uncontrolled growth of cells. Cells kana chembe sia na apate mubango kila muthenya cells sia mundu ni siana every day nicho kutimona nzui wenza ni yanano yenza ingi bwa siana ni siana no kitala ni nundu waekana si kwasa pando so they grow every day kupona na kana mwiwa mundu kila ibinda withwa ukiana na nicho kutimi ila wambia kuyana wa pe mwi ukakwa because they wambia kwa napata mubango. That's uncontrolled cancer cells. And that is jokutuma kila mundu wonde ena chance to develop cancer nundu kila mundu mwi wake ni yana kila mundu na kuyana na jokutimi cancers siana kwa mituwe kwa andala nini kwa siana na siana mituwe kwa mundu akorone cancer below 50 years it are very aggressive yana mituwe akorone cancer at 80 years it grows very slowly. So it's the rate of growth of cells which matters in cancer. Jokutuma pe cancer mwe siana mituwe ingi yana ingi ona wa watu kweta usiai sia tantu yet that we don't even treat. Na to me depending cancer that what and in the and cancer deba na more important this is more details for the doctors now which are with their cancer nyamo them weba nondo ilata mina kwacha mundu na cancer da nondo ndino wa nondo be cancer pakube 15 inondo yoka and this mainly nicho kutumona cancer si mundu karone cancer umwe akiitwa aibwa olonge akiitwa aelewa niki because of the type of cancer in that organ.
Okay, the ya cancer ni si 15 ni si lakini nene wa sekana cancer ni siende na kuongeleka wa miaka miongo tatu ye ba witina ndina imbingi muno ni chao kila kitumite cancer yongeleka muthembo nondo twasisi ona ba ukamba kuito pakube kila musi nito weto cancer.
Exactly. I think if I remember well nino tukumeta Masaku. I was in Machakos 1993. I was there Moich. Nino ngame spele Masaku 1993. Kuni is the condition around at that time ilana ngame spele Masaku ta medical superintendent nikana cancer was not common. It was not actually there. Of course, as a pathologist, that time I was already a pathologist. Na diagnosis was not a lot. Cancer, it was far. But of course, now the cancer, of course, it will become common. Cancer will be killer number 1 in the next, of course, in the next 10 years from now. Now it's killer number 2. 2025 killer number 2. Very soon you'll be killer number 1. Na hicho kitu we did no last month that create awareness na we follow kila turona kweka kinu chambe nekana kila kieta cancer pa kinu kieta cancer kila kipo ni simulation of the cancer. There's a difference between risk factors and the cause of cancer. There's no cause of cancer but the risk factors of cancer. Now nicho kitu everybody kana mundu wonde ena risk kana ena kinu chodho thea kwata cancer na nicho kitu matukwano kila chodho thea kwata cancer no kinu kimwe food leu nothing else. We don't even go many other factors. The factors ilasia kunywa skala, ilasia kunyoki, ilasia inheritance. Lakini kila chozo there cancer as we know ni leu nothing else. So that's what that major issue. Now this one of course I'm trained on cancer control and prevention from US. Now training almost 25 years ago, 26 years ago. When I was trained about cancer control and what are the risk factors of cancers in 2000, when I came to Kenya, I nenezi or woki Kenya to have so many cancers. And that's why matuku maingi nena about control. Dina na mona about treatment actually. I don't mention about treatment because treatment for me it cannot save life. It is prevention na kusia na kuteisia cancer. With the no meteisia the metoke. That's what saves life. Na nichokutimina low is the major risk factor ya cancer. Just food. Now the bottom line ni refined food. Nondo nineze asiaisa maitu omonde kila modu na chain. Nanya chain na sukali. Sukali actually is the cancer feeder number 1. Sugar is cancer feeder number 1. Nichokutimona ten chai it was not common. The year was not common every day. Refined food, mukate na mandasi, na chapati, na mosele, na most of the chips. I don't know when chips came to in Kenya actually. It was not there. It is in maleo to weyala masunge malea ala memoyo. Remember in ununa chakana cancer ni mwiwe na ku oende we leula we moyo ni wo wetakete ni cancer. The sweeter the food, the better for the cancer to grow. Ko iloko ya leula museo, the leula wa we to museo, we na nama, we na mauta. All that food is what making us to have cancer. That's why nichokutimko na matukwano cancer is so common because nundo leusu ni watu wa kila madana. Now changing the people mother leula wake kamba the traditional food, African food, leula wake kamba it's not easy. Na most of the times now we are focusing on advising people in the matona kweka wese than mambe yako sio kwa leula wa mukamba, which is not very easy and it cannot be done. So leula we na moyo not leula moyo ndio kwata tabata you mutongo TV in masako ukala kulipa masako no kasia wenda kwa that isyo you have to look for it. You can't find it. You look for it.
No, imandie mwana.
Ukala kwa chizi wenda kwa chapati kana mkate. You don't look for it, it's there. In fact, you buy it on the street.
na ndakisale ngokulia tu kwa liu. Maliu mwetu ona mwasu matene. Tiana manga tu na makwasi sino izu sionde sibo. Ne batu waneko na setu keda tusianangite kwesela nzila te kwema nasyo.
Not really. First they can ndia dawo to GMOs. I don't want to talk about that one.
GMO lakini no isivyo na farm inputs. Bila watu utomia ndani.
Not even farm inputs. Nandwa nini mapanda ambe malage kamba kila mpemba ondela tupandita tu uketha yu inatho ya mubuko. That's already GMO.
Tiawane ya isovika.
Mundulo unobande nana monde yu is not the normal inana. That's already GMO. This story is long. Ku pe kila tanangite imbe na zilata nyakwacha. Ingombe niziba tikatune kana kailo. Ya no ni ngombe ngedi umeta kondo kunge zaiti we ngombe mwe produce ya dia liter 10 per day. Katuna produce ya nusu kikombe. So
sorry.